Hi, welcome back. This is just going to be a short video helping you to distinguish the difference between cardiac ischemia versus cardiac infarction. And we have to remember that our coronary arteries are going to be the main vessels bringing blood and oxygen to our heart and to meet the demands of our myocardium or myocardial tissues. And when there's an imbalance between the demand and then the supply, we may have a situation where we're not meeting the metabolic needs as well as the oxygenation needs of our cardiac tissue. If it's under 20 minutes, then we determine this or we term this as cardiac ischemia. But once it's over the 20-minute time frame, this is cardiac infarction. Now, cardiac ischemia can begin at about 10 seconds of a an imbalance of oxygen supply to our heart tissue. And with this imbalance, as it continues to increase to about 20 minutes, then we're in an ischemic attack that can now put our heart at risk for not responding to the electrical impulses that we have that derive from our SA node to our AV node and moving down to the Purkinje fibers. And these abnormal responses can actually be picked up in an EKG. And this is what we call a dysrhythmia or arrhythmia. And they are the most common complications of an acute MI as well. These dysrhythmias will then impair proper cardiac pumping. When we have improper cardiac pumping, we will then, of course, have less cardiac output that overall can result to heart failure, or we can move in the same circle, which will continue to potentiate a imbalance of coronary supply and myocardial demand. And then we keep in that loop. Well, eventually, if we aren't able to correct this within the 20-minute time frame, now we are at a period of myocardial infarction. So it's that 20-minute time frame that helps us to differentiate between the two. And it's because at that 20 minutes, that lack of response to our electrical impulses can now make it a situation where we have a failure to contract the overall heart muscle itself. With that impaired cardiac pumping or no pumping at all, this leads to heart failure, but it also leads again to an imbalance of coronary supply and myocardial demand. We're also going to be at a higher risk for arrhythmias or dysrhythmias, which can be a situation that can lead to sudden death as well. Now, when we're in this period of not meeting our oxygen or having a deficit in the myocardium oxygen, it will overall result to cellular death. And with cellular death, we have a situation where there's going to be a release of intracellular enzymes, including troponin. And this is why that troponin lab is going to be important to help us to watch the trend of symptoms against our patient and our lab to determine their risk for infarction or where they are in this state of myocardial infarction. And we also know that there will be apoptosis and destruction of the tissue. It can also lead to just tissue necrosis overall. So it's really important to recognize those signs and symptoms and risk factors for ischemia and for infarction as well. But it all starts with an imbalance between coronary supply and myocardial demand. So when you're answering questions about MI and ischemia, and you're wondering what are some of these things that could put our patient at risk for ischemia or MI, first ask yourself, are they in a situation where the demand of oxygen is greater than what our heart, our coronary vessels are able to supply? Thank you for listening. And if you have any questions, please feel free to reach out to me for more clarification.